Masturbation is one of the most natural ways to experience self-pleasure. But a question I hear very often is, how much is too much? Well, I'm Dr. Rena, a urologist and pelvic surgeon, and today I'm going to share 3 ways masturbation could possibly cause harm if not done carefully. If you're new here, you should know that I strongly support masturbation. It's a healthy form of self-pleasure. It's safe when practiced properly, and it can help reduce stress, improve sleep, and offer several health benefits. If you want to learn more about those benefits and clear up common myths you may have heard, be sure to watch my video on the 7 myths of masturbation. But today, we'll focus on 3 habits that might negatively affect you during masturbation. The first is something known as traumatic masturbation syndrome. This term was first introduced and explained by Dr. Lawrence Sank in 1998. It refers to a habit of masturbating in a prone position, meaning lying on your stomach or pressing your body against a bed, pillow, or another firm surface. People who develop this condition often report low sexual desire, difficulty reaching orgasm, or problems with erections. While there isn't a large amount of scientific data on this, in clinical practice, we do sometimes see patients with these concerns. One study looked at nearly 2,600 men who reported premature ejaculation, aiming to find out whether certain habits played a role. Researchers asked them several questions, including details about their masturbation techniques. And many of these questions were open-ended. Many of the surveys you see reported in research studies are closed-ended, meaning they give participants 4 or 5 choices to pick from. But in this case, participants were asked open-ended questions like, "Tell us about your masturbation habits." What researchers found was that individuals who reported behaviors linked to traumatic masturbation, such as lying in a prone position or stimulating through clothing, were more likely to experience erection problems or erectile dysfunction. The next issue is something often referred to as death grip. So, what does that mean? It's not an official medical term, but it describes using an overly tight or forceful grip on the penis during masturbation. In medical language, we call this habituation. Essentially, your body becomes accustomed to a certain level of pressure, speed, or type of stimulation. For women, this might involve strong vibratory devices, and for men, it could mean gripping too firmly. Over time, your body adapts, making it harder to reach climax or feel the same level of pleasure with a partner because that same intensity isn't present. This can turn into a difficult cycle. For example, a man who regularly uses a very tight grip may begin to notice reduced sensitivity. As a result, he might apply even more pressure to achieve climax, which further decreases sensation. Over time, the need for stronger stimulation continues to increase just to reach the same level of pleasure. This pattern is often described by doctors as an idiosyncratic masturbation method, meaning a style that a partner cannot easily replicate. In this situation for a man, it could involve a partner's mouth, hands, or vagina, or even a specific fantasy that's hard to recreate during partnered intimacy. In a smaller study of about 500 men experiencing what we call delayed ejaculation, meaning difficulty reaching climax, around 37% reported having these kinds of idiosyncratic masturbation habits. It's not only about grip. It can also involve a particular speed, a preferred position like prone masturbation, or even using a specific object every time, something that simply can't be reproduced during sex with a partner. And yes, this can be a very uncomfortable topic to discuss with a partner. But before you start blaming yourself, it's important to understand that changes in genital sensation can have other causes for both men and women, and medical reasons should always be considered first. For men, this might include low testosterone levels, certain medications like antidepressants, which I've discussed in another video, as well as conditions like diabetes or past injuries in that area. It can also be related to alcohol or drug use, since these can slow down the nervous system and reduce sensation. On top of that, lifestyle factors play a role too. If you're sitting for long periods, something many people experience during COVID while working from home, or if you spend a lot of time cycling, These habits have also been linked to reduced sensation in the genital area. So what should you do if either of the first two issues we talked about applies to you, and you're sure it's not caused by a medical condition? First, consider taking a break from masturbation for a couple of weeks to allow your body to reset and return to more natural sensations. When you begin again, try changing your approach. I often recommend using a lubricant, as it can provide a pleasant sensation while reducing the level of friction you may have been using before. You might also want to step away from pornography and avoid the same types of fantasies you previously relied on for stimulation. Instead, try focusing on internal thoughts and imagination, rather than depending on external visual or written material. It can also help to use your hands rather than relying on toys or vibrators, which can sometimes create stronger stimulation than your body needs. In addition, speaking with a sexual therapist can be very beneficial. They may guide you through techniques like sensate focus, which involves paying attention to touch and pleasure with your partner without the pressure of intercourse. This helps shift your focus away from performance anxiety and towards simply experiencing connection and sensation. Finally, another risk, especially for men, comes from very aggressive masturbation techniques. This may include bending the penis, which can lead to a condition known as a penile fracture. Any forceful bending of an erect penis can cause this injury. In simple terms, it involves a tear in the tissue surrounding the erectile structures. You might hear a popping sound, followed by swelling and significant pain. This is a medical emergency and requires immediate surgical care. If you're masturbating when the penis isn't fully erect, you do need to be cautious because this can sometimes lead to injury. In some cases, small or micro injuries can occur, which over time may form plaques and eventually result in curvature of the penis. Otherwise, if you're not experiencing any of these issues and your masturbation habits are healthy and you're not having difficulty during intimacy with your partner, and you're still able to enjoy both your partner and yourself, then it's perfectly fine to continue. Masturbation can be a healthy and positive way to experience pleasure and express yourself. Now, coming back to the question I'm asked all the time: how much is too much? I wish there were a specific number I could give you, but there really isn't. If you find that you're masturbating several times a week but still going to work, handling your responsibilities, being present as a partner or parent, and it's not interfering with your daily life or taking up large amounts of time that could be used productively, then it's generally not a problem. However, if you start noticing that you're choosing masturbation over spending time with friends or being with your partner, then it may be time to take a closer look. Consider how often you're doing it, the methods you're using, and whether changes could help you feel more balanced and fulfilled. I hope you found this helpful. Remember to take care of yourself, because you truly matter.